So if you are going to proceed down the path of having robotic surgery, most people will come to the hospital on the day of the procedure. They'll be introduced in the same day centre to the anaesthetist. They'll usually have a very minor bowel preparation, usually a suppository. They'll have to fast from midnight the night before. On that day, the anaesthetist will meet them, take them to theatre, and they'll be put asleep to have their surgery. The surgery takes about 2 hours to do, and usually they are kept in the recovery room for about 2 hours after the procedure. When you're back in your bed that evening, you feel fairly comfortable. You might have some minor discomfort which requires some mild analgesics such as Panadol or occasionally slightly stronger tablets. This is a relatively non-invasive treatment, but in general terms people stay in hospital for 48 hours. By that stage they're well and truly walking about the ward. In fact, they're walking about the ward the next day, and all the tubes apart from the catheter are removed usually 24 hours after the surgery. Before the operation, I always come to see you in the same day centre or in the anaesthetic bay and try and reassure you, because it's obviously an anxious period of time. As you know, everybody will have had a very long session with Jane, who will have gone through as many of the possible issues with you and your partner to make sure that you're comfortable with every single piece of knowledge on the day of the surgery, and in fact on the days that come after the surgery. As soon as the surgery is finished, I'll be calling your chosen person to contact, be that your partner or friend, and that will be done immediately the surgery is completed. And I'll actually visit you in recovery, although you may not remember that visit because often you're a little bit sedated. I'll also come and see you on the evening of the surgery to make sure you're well, and indeed every day after the surgery to make sure that you're recovering nicely. And the clinical manager will be in contact with you as soon as you're discharged from hospital, and she will arrange and set up the appointment for the removal of the catheter on day 6 as planned. We're also very aware that surgery can be daunting for all of us. You don't need to worry, because we have the most accomplished, experienced team looking after you at all times. So don't worry, the anaesthetist, the scrub team, the recovery staff, my assistant, myself, we're always there, we're looking after you the whole time.